everybody. My name is Dr. Jeffrey Tucker, and we're here at the FCA. And what I want to share with you this morning is to talk about a common phenomenon that we all see, which is tight hip flexors. And I want to take us through a little bit of a tutorial that I've been using in the office for quite a while now with patients who have tight hip flexors. And the first thing that I become aware of that they're going to need some type of intervention is in their static postural analysis. I might see a bilateral anterior pelvic tilt. I might see, looking at them from the side view, a little bit of an indentation in here where it's just difficult for them to stand up completely straight. And you, as a muscle whisperer, this is going to start getting you to think, oh my gosh, this person may have tight hip flexors, and we need to start programming them for that. It relates to all the people that are sitting so much day in and day out, so they're the ones that especially need this. One of the other things that I'll notice in my active range of motion testing is that the patient might have difficulty putting their arms up and going into extension. So I'm with Jessica, and Jessica's going to be working with us throughout this tutorial and doing some of the poses, and we'll interact together to show you what I like to do. So Jessica, let's just put our arms up, which is an actual, test in and of itself to see that if a person can. And then as they arch back into extension, I like to see where they're extending from. Are they pivoting in the lumbar spine, or are they getting a nice multi-segmental extension? And what I also look for, and one of the major clues that tells me they have tight hip flexors, is if their ASIS is not out in front of their toes, you can relax, then that's another clue to me that those hip flexors are tight. So those are 3 indicators right there. Otherwise, I could next go to a table and put them into a modified Thomas test, and that'll really help me tether out whether I've got an overactive psoas, an overactive rectus femoris, or an overactive TFL. And I might just start putting them into some static poses. I'm very, very much into slowing things down with patients. I want you to get that concept this year. That's one of the things that I want to make sure that we're not rushing our patients through movements, because when they go fast, that's when they're not experiencing or exploring their potentially newer movement patterns. When they're going fast, they're in their default pattern. So I want things to be slowed down. So I might just start out with a static psoas stretch. So if my patient's able to get down on the floor, that's important. If they can get down, then we'll start in a half kneeling. So let's go into a half kneeling, and if you like, I'll let you use this so it's soft on the knee. And let's do right foot forward, left foot back. So go ahead. Yeah, go ahead. You can. Let's go right foot forward, left foot back. Good. And I want to make sure that Jessica's on her toes. I don't like when I see people have their foot like this. If it's on the ground, I want you using it. So get those toes and that forefoot well planted, and let's get this front leg at a nice 90-degree angle. Let's get our pelvis in neutral. Hold it in neutral. Glide forward, and now let's move that down leg into external rotation. Move it out. Good. The foot. Good. So that moved the hip into internal rotation, and let's glide our pelvis forward. Let's maintain our chin in good position. And Jessica, I want you to actually elongate the neck as well. Good, she looks good. And take that into your nice stretch where you feel that in through the ASI region, in through the psoas region. And now we can bring our arm up, reach up. I'm gonna have you extend the wrist, open the fingers, and I want you to really reach through my hand. Once a patient is in a pose, I ask him to hold it for 30 to 60 seconds. And for this demo, we're just going to do one side at a time. So She looks nice and in position in the ribs. I know she's feeling it in through here. She's breathing comfortably, reaching up. This is one of the new cues and the keys that I want you to really get. If they feel very wound up and very tight, you can ask her to go into a little bit of rotation and a little bit of lateral bending as well. And that'll take us through one of the 3 major hip flexors that we want to check. Good. Come out of that nice and slow so there's no rebound. Very good. So then we want to check the rectus femoris. So let's go back into, we could do the opposite side this time. We'll go kneeling, half kneeling, we call this. Get into a comfortable position. Good. Now we're going to just start by bringing your right heel to the buttocks. And if you can reach back with the right hand or the left hand, I prefer the left hand, hold it into that nice stretch. Now here's the cue. This is what I want you to get for this year. Notice that I put her on a stability pad because the ground is just too hard. Floors are too hard. Carpets are too hard. So I keep the stability pads in the office and available for patients. It's comfortable, right? Good. Here's the next cue that I want you to get that we've been missing. We've been letting our patients go right on the patella. It's not comfortable. So let's roll forward into the distal part of the femur. Keep going as much as you can. Get as much of this part of the femur on the pad or on the floor of the carpet if you must. And it's a different feel completely. And then let's reestablish all of our good positioning, right? Heel to butt. We're going to reach back. And how about that same arm drive? All of the cues that I'm giving you now are important. I want you to reach up through the palm, externally rotate. All of our patients are like this, right? They're internally rotated here, and we're so trying to get them to open their chest, to externally rotate those shoulders, activate those posterior scapular muscles. So externally rotate here, reach, and once we're in the pose with good head positioning, good arm positioning, good rib cage positioning, good pelvic position, pull that heel to the buttocks, hold it for 30 seconds, and then release nice and slow so you don't get that rebound. You look good, right? How does it feel? Good. It's a nice stretch. And then let's just stand up, and we could cross right leg over left for a nice standing TFL stretch. So let's push our hip way over to the left. Do you feel a stretch in this TFL area? Just, you may have to vector your pelvis slightly. And I'm really loading my pelvis to the left. And this is my target tissue where I feel it. Get your shoulders level, head in good position. Actually retract slightly. Try to elevate the neck. Beautiful. And again, once you're in full position, you're going to hold that for about 30 seconds while you're breathing. Good. I would want to make sure your shoulders stay completely level and you're really just moving through the hips. That's good. So that takes us through the 3 static stretches, incorporating the stability band. If I was going to go in an advanced position with her, I could use some CLX bands as well as our arm lever drive. Then what I'd like us to do is a press up. So let's just find our way into a nice press up pose. And I have a new cue that I would like to introduce to you. And again, staying with these concepts, these postural concepts of really getting our patients out of this position to this position. All it takes is Jessica's in a nice pose, and we'll go into our press up, and let's externally rotate our hands, drop our shoulders down. Now I want you to really push the toes into the floor, feet into the floor, legs into the floor, thighs into the floor. Give me a nice multi-segmental arching of the back. She's stretching all those anterior muscles. I want you to retract your head, push your hands into the floor as hard as you can, and just breathe. So again, I'll keep cueing you. Push the toes into the floor, the foot the front of the foot into the floor, legs into the floor, thighs into the floor, pelvis down, arms extended, palms are really... Okay, so how's that feel? It's different, right, than just being passive and hanging out. You're activating more muscles. You're really activating more of the core in this position. You might want your head here and then try again to elongate this way so that I'm really extending and elongating those segments of the cervical spine. And at the same time, she's stretching out those hip flexors. Good. Take a rest from that. Low, keep the shoulders down. So I like that we did the press up. Now let's go into a staggered stance together. So I would like you to please put your glasses on. We're big proponents at Performance Health that when we're using the CLX bands that we wear our goggles. So have these available at home. If you're wearing glasses like I do, then you're okay. So a staggered stance is literally just that. Now I want to take a patient through this pose, especially if they can't get on the floor for the previous ones. Then this is where I would start. So a staggered stance is just literally, let's bring our foot back, right foot back. And if they're having difficulty balance, they may need to go wide. If their balance, or we want to challenge their balance a little bit, we'll go into a more narrowed stance. But the important thing here is that the feet are straight ahead. Let's keep both feet perfectly straight ahead. Get that right foot straight ahead. Good, there you go. And push that heel into the floor. So now we're getting that Achilles stretch. We're getting a nice elongation of that fascial chain. And we'll keep our pelvis in neutral. And we'll just glide forward. We can use our arm driver. Or this is an opportunity for me to use the CLX station. I love this in the office. It allows me to have bands attached to all kinds of different heights. I can have all the different colors up at the same time. So I'm just going to give you the blue, which is a little bit stronger than the red and the green, and I'll have you hold it, one in each hand. We open up the loops. I assist the patient. Good. I'll work with you here. And this will just help control our balance by holding on to this, right? So we're in a right leg backwards, left foot forward, both feet are straight ahead, pelvis is in neutral. Let's get our ribs in good position. Hold the ribs in. Shoulders are in a nice neutral position. I want you to elongate through the head. Push that heel into the floor, the right heel into the floor. Bring your pelvis forward. Do you feel a nice stretch in the front of the thigh? Good. That's a great hip flexor stretch. Now what I want her to do, again, is utilize the band in a Brugger's position. So take your hands like this. Let's go into extension at the fingers, extension at the wrist, externally rotate, hold that. Breathe. So each cue, foot into the floor, pelvis neutral, bring your pelvis forward, hold the ribs in, shoulders are level, her head is tall. Do you see all of these cues? They matter. Once they're in good position, I want my patient to hold it for at least 30 seconds. Okay, good job. Relax that, come out of it slow. You could put that band down. Then we're going to take a look at the half kneeling. So I'm going to have Jessica come over here. Come on over here. I'm going to give you this to hold on to. And Jessica, let's go into a half kneeling. So this is tall kneeling. And then go half kneeling. And we're going to put your right knee on the pad. Here's how we're going to make this a challenge. I want you to lift your knee 1 inch off of the pad and hold it there. And now pull into a row position. So now I'm working that posterior chain, and I keep testing myself. Am I about an inch off of the ground, that knee? I just want to hold it there in a static pose, and I want to re-cue her. So elongation at the head, chin retraction, shoulders level, posterior chain is on, getting that hip flexor to stretch. And actively, she's working her core to stay in this position, aren't you? Right, good job. Come on up. And let's see if we can get one more in with you, which I like to do, which is a pigeon pose. So we'll go into a pigeon pose. Go ahead here. We don't need this. But we can go right into a pigeon pose like this. She's got good flexibility, and the cue that I want to give her is pushing her hip to the right as far as you can. Good. And then if I have bands available to me to increase activation of the muscles, I will oftentimes have them in the hands, which is giving them a pull here, or I can wrap them around. Can I just get you to turn around this way? So if we're in the office, yep, face that way completely. And Jessica, I'm going to wrap this around your foot, just like this. And I want you to keep sliding forward in that pigeon pose. And this is the concept that I get so excited about with patients. Keep going till you feel some traction in that hip. A pull in through here, which is allowing this to stretch further. I'm now opening up that hip joint. She's still stretching this posterior capsule, this piriformis, and the other muscles that would attach on that right side. So this is a very, very dynamic pose. You know, it's known as the pigeon pose, and it's great for that tight posterior capsule and posterior muscles, which are often associated with tight hip flexors. Do we have time for one more? Okay, thank you so much for participating. There's lots to this tutorial, and in part 2, we'll continue and do some more. Thank you so much.